So we're going to be doing the head, the neck, the pecs, and the anterior shoulders. You're going to begin by setting an intention. Once you have set your intention, you can gently place your hand on your client's shoulders. Introduce your touch. And from there, you'll bring your hands into their scalp. You want to make sure that you move that scalp around. Get into those temporal muscles. A little circular friction. You can join your fingers medially at that occipital ridge and work your way out, doing circular friction, palpating, feeling for what's going on in those posterior neck muscles. Are they lengthened? Are they shortened? And you want to make sure that you use a significant amount of pressure because those muscles on the posterior neck are pretty deep. If you're very superficial, you're not going to get a quality for the muscle fiber. You can bring your thumbs to the top of the head and continue to do circular friction as you rake your fingers over the temporal bone. And then from here, you can explore the temporal mandibular joint and make sure that's not tight. If it is, you can do a little circular friction. Do a little ischemic compression. And then from there, you can just bring the top of your hands onto both shoulders. Make sure that both of your feet are firmly planted into the ground. And go ahead and push those shoulders away, alternating your hands progressively. Go a little further each time, looking for that barrier. And then you can push both of them at the same time. Make sure you use your body. From there, I'm going to leave one hand on my client, use the other hand to gather my lotion. Spread the lotion. And begin to work at the chest. Using effleurage, you're just gliding, lubricating the area. Gather your strength from the whole body, from your feet, up your legs, into your hands. Make sure that you're sitting straight and that both of your feet are firmly planted onto the floor. Now you can proceed to do a little effleurage. Lift, squeeze, and press the tissue. You can use your knuckles and strip the fibers of the pec. You know that the pec minor is medially rotating the shoulder, so you're gonna have to go just a little deeper to make sure you're getting into that pec minor also. And then back to your gliding. And then you can proceed to go explore the shoulders, see what's going on in the pec muscles and your trapezius posteriorly. You don't want to have too much lotion on, because if you have too much lotion on, you're not going to have enough drag. And notice that my hand is posterior. So I'm going for the muscle. So make sure that your hands are covering this whole trapezius area so you can access the fibers of the levator scapula. You can use your knuckles. Notice that I haven't used my thumbs, not even once. Have your client take some nice deep breaths. And with your knuckles, you can do some circular friction over those fibers of the trapezius and your levator. And if you are posterior enough, you might be able to just get a little bit of the rhomboids as well, that they're elevating the shoulders. Then from there you do one whole sweep. You come back and you can bring their neck to the side. And you're gonna do your effleurage move to warm up the whole area, for all the way from the acromion to the occipital ridge. And initially my hand is superficial, and as my strokes progress, I'm gonna go just a little more deeper. If I don't go deep enough, I'm not gonna feel the quality of the muscle fibers, so you need to make sure you go in deep enough. On my fourth time around, now I'm gonna use my knuckles. Make sure you don't go over the bone. So start where that supraspinatus is at and strip all the way up to that occipital ridge. When you get up there, do some circular friction with your knuckles. And then come right back down again. When you come back this time, try to see if you can find that trigger point that's right at that superior angle of the scapula, and take your fist and do some ischemic compression. Have your client take a nice deep breath in. And when they exhale, go in a little deeper. And you want to hold that ischemic compression for about 10 to 15 seconds. Every time your client exhales, you want to try to go in just a little deeper. And I am finding my strength from my feet into my legs, through my core and into my fist. And now you want to go back and make nice with the area. Do your effleurage. Come back. Now we're going to explore into the neck. You want to strip these muscles. You can start with light pressure and then work your way into it. Strip all the little short muscles of the posterior neck. Remember, you have multiple layers, so make sure that your fingers go in deep enough. You can finish right at that supraclavicular ridge and try to sink your fingers deep. Now you can take the ulnar side of your hand and try to strip the sternocleidomastoid and the scalenes. You sink your fingers deep into that supraclavicular ridge. Drag the pressure. Don't hold it, because remember, we have that brachial plexus and the artery. When you get to levator scapula posteriorly, push. Have your client take a nice deep breath in. And go back and make nice with the area. Notice how my fingertips are white. That shows you how much pressure I'm actually applying. And my client's nonverbal is telling me that she's okay with the pressure. How is the pressure?
Good.
Is it tolerable?
Mm-hmm.
Okay. On a scale from 1 to 10?
Probably a 3.
Okay, good. Now remember, if you communicate with your client and they tell you that the pain threshold is above a 6 or a 7, you want to kick it down. You don't want anything that's causing more than a 6. Okay, I'm going to go back and make nice with the area again. And then what I'm going to do is I'm going to do some opposition, because the muscles of the neck are shortened, and our best technique to help with those shortened muscles is going to be to do some opposition. So I'm going to take my opposite hand to her shoulder. Make sure that both of your feet are firmly planted into the ground. And then my opposite hand to the back of the head, and I'm going to separate both of those body parts. Tell your client to take a nice deep breath in. When she exhales, I'm going to push it a little further. And one last time. You push until you feel that barrier. Hold for about 10 to 15 seconds. And then you release. And you bring the body part back to its normal resting length.